achieve two main goals of the ECQ. First is to slow down the transmission and spread of the virus. This is what we have been calling as flattening of the curve. Isipin po natin na ito ang unang nating sandata laban sa COVID-19. While practice makes perfect sa hand washing and cough etiquette, ang physical distancing ay mas mahirap gawin kung walang ECQ. Halimbawa, kung walang ECQ, papasok pa rin tayo lahat sa trabaho. Paano ito susundin ng libo-libo nating kababayan na nagko-commute araw-araw? Kung wala ring ECQ, lahat ay pupunta pa rin sa mga malls para manood ng sine, kumain at mamili. Hindi may iwasan ang magdikit-dikit at magkakabanggaan ng mga tao. So habang nagpa-flatten at nagsa-slow down ang local transmission ng virus sa ating communities, the second goal is to increase the country's healthcare capacity. Mas nakaka-catch up po ang ating sistema at mas makakapag-adjust para matugunan ang requirements ng mga ospital, quarantine facilities at isolation units. Kasama po rito ang pag-procure ng PPEs or personal protective equipment, paggawa ng malakiang quarantine facilities, at pagsasaayos po ng staffing schedules ng ating mga ospital. Iniiwasan po natin mapuno ang ating healthcare capacity para mas ma-accommodate ang lahat. Kapag sabay po natin itong na-achieve, we will be able to beat this pandemic. We just need to remember these two main goals. Slow down the transmission and increase healthcare capacity to be able to properly accommodate every single patient. Majority of COVID-19 cases natin dito sa Pilipinas ay made up of elderly at mga kalalakihan. Base sa ating datos, 42% of adult Filipino men are smokers and about 1 million are vapers. Gusto po natin silang paalalahanan na mas vulnerable po sila sa COVID-19 kaysa sa ibang tao. Smoking is known to weaken the immune system, making it less able to be able to respond to infections. According to the WHO, smokers contract more respiratory ailments, including colds, which also belong to the coronavirus family. Furthermore, WHO also said that the act of smoking means that the fingers and possibly contaminated cigarettes are in contact with lips, which increases the possibility of transmission of the virus from hand to mouth, making the smokers more vulnerable to COVID-19. Sa isa sa mga pinakamalaking pag-aaral ng mga COVID-19 patients sa China, smokers comprise more than 25% of those who needed mechanical ventilation and admission to intensive care unit or died. Exhaled air through smoking and vaping is not safe. Base sa mga laboratory experiments, sinasabi ng mga scientists that some form of spreading by air is playing a role in transmission of the coronavirus. Dahil po rito, pinapakiusapan po namin ang mga smokers na huminto na sa paninagarilyo para na po sa inyong kapakanan at kalusugan. Pinapaalalahanan din po namin ang general public na umiwas sa second-hand smoke mula sa vape or sa regular cigarettes. Dito pong mga nakaraang araw, nakita po natin sa ating case bulletin updates na mas mataas po ang bilang ng nasawi sa COVID-19 kumpara po sa mga naka-recover sa sakit. Hindi dapat natin to ipangamba dahil gaya po ng nabanggit ni Yusek Vergeres sa nakaraang presser, matagal po ang proseso ng paggaling or recovery of the COVID-19 patient. Ayon sa scientific evidence, it will take around 2 weeks para gumaling ang mga may mild cases habang 3 to 6 weeks naman po ang mga may severe or critical cases. Kaya naman habang patuloy po ang ating efforts sa pag-improve ng ating testing capacity at ngayong may comprehensive guidelines na tayo para sa expanded testing, tinitiyak natin na the numbers will start covering even the mild and asymptomatic cases. And once we do this, we can get a better picture of our recoveries in the country. Kagaya ng naibalita kahapon, tinapos na po ng Procurement Service DBM ang inspeksyon sa mga dumating na PPEs at pinamahagi na po ito ng Office of Civil Defense. Ang naitirang mga PPP ay napadala na rin sa mga public hospitals. Ang pangalawang batch of PPEs ay na-deliver noong April 6 sa mga sumusunod. RITM or Research Institute for Tropical Medicine, 2,000 sets, Veteran Memorial Medical Center, 1,300 sets, Quezon City General Hospital, 1,300 sets. Jose B. Lingad Memorial Regional Hospital, 2,700 sets. Bataan General Hospital and Medical Center, 1,400 sets. Mariveles Mental Wellness and General Hospital, 1,100 sets. Bicol Regional Training and Teaching Hospital, 2,200 sets. Habang ang kalahati ng third batch po ay naipadala kahapon, April 7 sa Jose Reyes Memorial Medical Center, 800 sets. Tondo Medical Center, 800 sets. National Center for Mental Health, 800 sets. Quirino Memorial Medical Center, 800 sets. Ilocos Regional Training Medical Center, 1,300 sets. Batangas Medical Center, 1,300 sets. Baguio General Hospital and Medical Center, 1,100 sets. Ngayong hapon naman po, ang delivery ng kalahati ng third batch. Ang mga makakakuha po nito ay Las Piñas General Hospital and Satellite Trauma Center, 1,300 sets. National Kidney and Transplant Institute, 1,300 sets. National Children's Hospital, 1,300 sets. At Rizal Medical Center, 1,300 sets. We have also been distributing the PPEs and other commodities to private hospitals. This week, Marikina Valley Medical Center will get 1,000 sets and Manila Doctors Hospital will get 1,000 sets. Yung mga iba po pong listahan ng aming na-distribute ay available po sa website ng DOH or sa Facebook page. In line with the Bayanihan We Heal as One Act, lahat ng COVID-19 patients ay covered na ng PhilHealth, kahit po yung mga hindi pa nakapagrehistro sa PhilHealth. Ito ay alinsunod sa Universal Healthcare Law o Republic Act 11223 na nagsasaad na every Filipino shall be automatically included into the National Health Insurance Program or PhilHealth. Gusto rin po natin ipaalam na nakapagpalabas ng 4.1 billion pesos ang PhilHealth para sa tinatawag na interim reimbursement mechanism. Under the IRM, PhilHealth as a state insurer assures that hospitals are provided with funds necessary to cover the cost of treating COVID-19. Patients who are currently admitted or to be admitted. This will allow financial liquidity po sa ating mga hospitals to procure the much-needed testing kits, medicines, PPEs, and other medical supplies. Kasalukuyan namang nakikipag-coordinate ang PhilHealth regional offices sa mga ospital upang gabayan how they can avail of this assistance. Nais po naming linawin na ang coverage ng PhilHealth ay hindi nagtatapos noong April 14. Sa COVID-19 patients admitted between February 1 and April 14, 2020 who paid their hospital bills, PhilHealth will reimburse them in full. Starting April 15, 2020 onwards, all COVID-19 admissions will be covered using a new case rate benefit package, except for health workers who will receive the appropriate financial aid directly provided under the Bayanihan Act. Antabayanan po natin, PhilHealth will release their guidelines today at pakiusap po namin sana to not spread false and misleading information. Sana po ay magtulong-tulong tayo not to elicit public panic and disarray. Para po sa update, ngayong April 8, 2020, ngayong Miyerkules, April 8, as of 4 p.m., meron na po tayong 106 na naitalang bagong kaso ng COVID-19 positive patients. Ang total po ng positive cases natin ngayon ay 3,870. Nakapagtala rin po tayo ng 12 karagdagang pasyente na nakarecover mula sa virus. Meron po tayong total of 96 recoveries as of today. Ang mga naitalang nakarecover ay ang mga pasyenteng nakakonfine lamang po sa mga ospital. Maaring may mga positive and mild asymptomatic cases na nakarecover mula sa kanilang self-isolation at home quarantine na hindi po kabilang sa numerong ito. Subalit, 5 po ang naitalang pumanaw dahil sa COVID-19. Ang total number of COVID-related deaths natin in the country is currently at 182. Kami po ay taus-pusong nakikiramay sa mga pamilya at kaibigan na naiwan ng mga COVID-19 patients. Sa ngayon, it is too early to tell if these cases are already or actually decreasing. But rest assured, we are exerting our maximum effort to track all cases to see a better picture at the soonest possible time. Since we are already talking about numbers, we would also like to inform the public of the sources of data that we report every day. Dalaw po yung main sources natin. Una, ang case investigation form at pangalawa, ang laboratory information system. Sa lab info system nakatala lahat ng taong tinest as well as their results. Yung CIF naman ay kung saan nakasaad yung name, age, occupation, travel history, at iba pang mga detalye ng mga pasyenteng may sintomas o mga contacts na nahanap mula sa contact tracing. Ang mga hospital or contact tracers ang nagfi-fill up nitong form na ito. Unfortunately, the data submitted to us are often incomplete or are in hard copies. Kung hindi kumpleto, isa-isang tatawagan po ng ating Epidemiology Bureau yung mga ospital para malaman yung lahat ng impormasyon. If the occupation field is left blank, we will never know from our database how many health workers were actually affected. If the questions on travel history are not filled up, we cannot say how many for sure that of those got affected got it from travel or were just locally transmitted. Again, gusto lang po namin i-demonstrate that each one of us has a role to play in ensuring that our information is accurate. And this information will help us reflect the true picture. Bayanihan talaga ang pagsugpo sa krisis na ito. With the increasing number of cases and corresponding increases in cases that needs to be traced, we have more than 10,000 CIF paper forms that are being encoded with the help of partners and many employees working from home to reduce the number of backlogs. By Sunday, April 12, we aim to have 0 encoding backlogs. Starting this week, all are required to submit the CIF forms and lab results online. This will save our Epidemiology Bureau time and effort to consolidate the results. Ginagawa natin ito ng paraan ngayon para by Monday, we would all have this data encoded and we can see a more accurate picture of our cases. We will be offline to catch up with the encoding in the next few days and be back on Sunday. But this does not mean that our operations will stop. Our social media accounts will remain operational to keep everyone updated. Ngayon naman, sasagutin na po namin ang ilang mga katanungang nakalap namin. From Health Promotion Officer Ms. Chayla Marie Beninga of Oroqueta City, Misamis Occidental. Verify lang po if recognized po ito ng DOH. Reports of cases with COVID-19 have presented dengue-like manifestations like petechial rash, fever, thrombocytopenia, and false positive dengue serology test. Nagsisirculate po ito sa social media. So mayroon pong isang case report mula sa Singapore kung saan nagkaroon ng false positive ang dengue test ng 2 pasyente. Ibig sabihin, sa unang akala po ng mga doktor ay dengue ang kanilang sakit. Ngunit sa muling pagsusuri at pagtest, nalaman na sila po ay mayroon palang COVID-19. Dahil po sa posibleng magkalapit ang manifestasyon ng COVID at dengue, halimbawa, pwedeng magkaroon ng lagnat, paghihina or fatigue at pagsakit ng kasukasuhan, paalala po ng DOH sa ating mga doktor na panatilihin ang high index of suspicion para sa COVID, lalo na kapag may history of exposure ang pasyente. From our media partners, Joe Vicky of Philippine Daily Inquirer, does the DOH have any information on how many healthcare workers have so far died, been hospitalized, and put under quarantine due to COVID-19? Are hospitals also following the 2 weeks duty, 2 weeks off scheme that the referral facilities are implementing? Base po sa latest na datos na natanggap ng DOH, 252 na pong healthcare workers ang confirm na nagkaroon ng COVID-19. 152 or 65% po nito ay doktor, habang 63 or 25% sa kanila ay mga nurse. Kumpirmado po na ang 12 ang pumanaw na healthcare workers dahil sa COVID-19. Para naman po sa mga ospital, may flexibility po ang kanilang pamunuan upang ipatupad ang duty schedule na angkop sa kanilang sitwasyon. Also, can the DOH shed light on what is happening at NCMH? So the matter is already being addressed at NCMH, and NCMH will issue a statement today. Director Roland Cortez, the chief of NCMH, has confirmed that they have enough PPEs. This morning, they have received 500 sets, and yesterday, they have received 800. Based on UP's assessment, the estimated number of infected persons in Metro Manila once we peak in as late as June is at least 140,000. How are we ensuring that our healthcare facilities, including the community quarantine sites, wouldn't buckle as we treat these patients? Unang-una, the figures mentioned are assumptions na wala pong interventions na gagawin upang mapigilan ang paglaganap ng COVID. Hindi po ito tinitake into account pa ang ating mga efforts to flatten the curve na in-explain ko na po kanina. Sinisiguro natin na hindi magbabakal ang ating health system, kaya tayo may ECQ, at patuloy pa rin po natin kayong ine-encourage na gawin ang ating mga preventive measures like physical distancing, cough etiquette, at hand washing. At kasabay nito, itinataas din natin ang kapasidad ng ating healthcare system. Nagtatayo tayo ngayon ng mga community quarantine and isolation facilities, nagtalaga tayo ng mga COVID referral hospitals, nag-expand tayo ng testing, bumili tayo ng mga PPEs, at we're ensuring na merong available na kahit yung mga off-label na gamot para may magamit ng ating mga doktor. The first 5 subnational labs were identified early in February but only became operational in late March. The succeeding labs were accredited around 2 weeks. What policy changes did the DOH made in the accreditation of the testing centers? How can the public be assured that the safety and reliability aren't compromised as we expedite the accreditation process? The standards remain the same. Binigyan ang bawat laboratory ng self-assessment form para masuri nila ang kanilang kakayahan na magsagawa ng testing. Some labs actually required structural or infrastructure improvements while others required process improvements. Bukod po rito, previously it was only RITM that were visiting the facilities. Recognizing that there are increasing demands for RITM due to the increased testing, the DOH Licensing Office and WHO complemented the RITM staff to form a joint assessment team. We assured the public, bago po maaprubahan ang mga laboratoryong ito, sinisigurado po ng grupo na ito na sumusunod ang bawat laboratory sa mga standards po natin at rekomendasyon sa biosafety. From Rafael Bosano, ABS-CBN, how hard is the contact tracing now lalo't malapit nang umabot sa 4,000 ang kaso ng COVID? Is it still possible to trace every single contact of a patient? Does the DOH have enough manpower? So yung number of cases determine the number of contact tracers that we will actually need. So it depends on the area, and that's why we need also the help of the LGU. So meron din po tayong in-implement na risk-based contact tracing. No? So sa areas where we have local transmission, we limit the number of being traced into at least the contacts within the last 2 days. But it is different in other areas where we still don't have localized transmission. So mas extensive po yung contact tracing doon. Katulong po natin ang mga LGU sa pagsasagawa ng contact tracing, lalo na po ang ating mga magigiting na Barangay Health Emergency Response Team or BERTs. Malaking tulong po sila sa patuloy na surveillance o pagsubaybay sa kaso ng COVID-19 sa ating bansa. So rest assured that we are working to cover all that needs to be traced. So may mga katanungan din po tayong natanggap regarding mass testing. Para po sa mga masagot natin ng maayos ang katanungan na ito, pinagsama-sama namin ang mga kasagutan dito. So from Analu De Vera of Manila Bulletin, regarding the planned mass testing po, may specific date na po ba kung kailan ito ipapatupad and ano po mga guidelines ang nakapaloob dito? From Aiko Miguel of UNTV, paano at kailan po pwedeng mag-request ang isang karaniwang mamamayan na magpa-test po siya? Ikinokonsidera po ba ito sa ilalabas na bagong guidelines? Hindi po ba magandang panukala ng ilang eksperto na inahin po itest ang severe cases, tapos pag nag-positive, isunod ang frontliners na direktang nakisalamuha, nagalaga sa kanila, then isunod yung mga nakasalamuhang PUI and PUM? Okay, so sasagutin namin to in a consolidated manner. So we would like to reiterate again that mass testing does not mean indiscriminate testing of everyone regardless of their circumstances or simply upon the request of the patient. On the idea of mass testing, it is implemented in a manner that's expanded and targeted, as we are expanding the groups of people whom testing is indicated based on their clinical presentation. So factors such as presence of other diseases or being part of vulnerable groups and exposure to known or confirmed COVID patients. Doon po tayo nakatarget sa talagang nangangailangan ng testing. Therefore, to answer Aiko Miguel's second question, no, the DOH does not recommend testing per request without an indication. Health professionals shall remain the decision makers if someone needs the test or not. Regarding the guidelines, to answer Ana Lu de Vera's first question, DOH will release the finalized guidelines today. These include provisions on who will now be eligible to undergo testing and based on our expanded indications. And to answer Aiko Miguel's third question, yes, we have taken into consideration expert recommendation about who will be prioritized for testing. Patients or healthcare workers with severe or critical symptoms have the greatest need for testing, followed by those who have mild symptoms with a relevant history of exposure or are considered vulnerable, followed by those who are asymptomatic but have relevant exposure history. This prioritization is in place to optimize the use of available testing kits even as we continue to increase our testing capacity. Salamat po sa mga nagpadala ng mga questions nila. Ito lang po ang masasagot namin ngayong araw at iba pong mga katanungan ay sasagutin namin sa susunod na virtual presser. Bago po tayo magtapos, nais po naming magpasalamat sa Brunei Darussalam na nag-donate sa atin ng RT-PCR test kits worth 90,000 Brunei dollars or almost 3.2 million pesos. Ito po ay 20 test kits na dumating sa bansa natin at na-turn over kaninang umaga ng Embassy of Brunei Darussalam represented by Her Excellency Joraya Wahab. Patuloy pa rin po ang ating laban para siguraduhin ang kaligtasan at kalusugan ng bawat Pilipino. Manalig po tayo na sa ating pagtutulungan, ating pong malalagpasan ang sitwasyong ito. Nakadepende po ang kaligtasan nating lahat. Tayo po ay mga frontliners din sa laban na ito. Ang health system po ay ating second line of defense. Nasasalo po sa mga magkakaroon ng COVID-19. Kaya't inaantayahan po namin kayong lahat. Tayo po ay magtulungan sa pagsugpo sa COVID-19. Ipinapaalala rin po namin sa inyong lahat na ugaliing mag-fact check. Tumingin kayo sa verified at legitimate sources at siguraduhing tama ang impormasyon bago po ito i-share. Hindi po natin kailangan ng fake news ngayon. Tandaan po natin na buhay at kaligtasan ang nakasalalay sa bawat click and share natin ng fake news. Maging maingat din po sa pagpapakalat ng impormasyon dahil nakakalito po sila. Para po sa karagdagang impormasyon at mga updates, pumunta lamang po sa Facebook page ng DOH o di kaya sa DOH Viber Community at subaybayan po ang ating Beat COVID-19 virtual presser. Maraming salamat po sa PTV4 sa pagbibigay daan upang maisagawa natin ang virtual presser dito sa DOH araw-araw. Maraming pong salamat at mag-ingat po kayong lahat. Tandaan, together we can beat COVID-19. Maraming salamat po.
Yan po ang virtual press briefing ng Department of Health, mga kapuso. So sa mga nag-aabang ng kanilang update sa mga statistics, kaso, positibo, mga nasawi at naka-recover, ang pahayag po ni Dr. Beverly Ho, siya po ang Special Assistant to Secretary Duque, umabot na po sa 3,817 bilang po ng mga positibo po sa COVID-19. Nadadagan po ito ng 106